Let's step back and look at the big picture. America has the world's highest medical costs by a mile.
Right.
We have only mediocre health compared with other developed countries. What's the problem?
Well, I think that we do not have a system of healthcare delivery in the United States. It's a series of mom and pop shops all over the country, and it has not been systematized. I think actually, to be perfectly candid, I think we get a little bit of a bad rap in terms of not having healthcare quality the same as other developed countries do. And when you have a high murder rate and a high traffic accident rate and those sort of things, those all skew the data. But nonetheless, we're not as good as we should be.
Right. In other words, health isn't just a product of the health care system. It's a product of a lot of other things as well.
A tremendous number of things.
Yeah. Well, for the moment, focusing on the health care system, why are the costs, regardless of the outcomes, which are at least not bad, why are the costs so extremely high?
There's a series of things, and there's a dirty little secret behind this, and I might as well tell you the secret to start with.
Yeah.
The secret is that regardless of what happens about the legislation, the costs are going to go up, and the costs are going to go up for three reasons. One, we got more people in the United States. Two, we have more elderly people in the United States. And three, we can do more for them. So regardless of what happens, and we can really probably only try and contain the rate of inflation, but we are not going to, the cost is going to continue to go up over time.
So people's expectations have got to be recalibrated, because I'm sure a lot of people who are following this as normal citizens are thinking, well, we're going to see costs stop rising. They're not going to stop rising.
They're going to see that the total bill for health care costs for the entire country is going to continue to go up. Their individual costs may come down in terms of what they pay for their insurance, et cetera, but the total, but they're going to pay for it in a different way. They're going to pay for it in taxes in one way or another. The total bill for the country will go up.
Well, this gets to a very interesting question, because in any other industry that I can think of, if revenues are going up at a rapid clip, we look at that industry and think, this is exciting, this is growth, right? I want to be in on this. There's only one industry where we look at that chart and say, this is a terrible national problem, and that's medical care. Why is it that way?
Well, I think that we're only looking at one side of the healthcare equation. We're just looking at the cost, but no one ever looks at the other aspect of healthcare. The fact that suffering has gone down, diseases have gone down. Let's take just heart disease. The deaths from heart disease in the last 15 years have gone down 30%. Tremendous progress there. Also, you don't look at the fact that healthcare is a major product in the United States. It's the second leading employer in the United States after restaurants and the food industry. It also winds up doing a tremendous amount of research. It makes products. It's an export commodity. So it is a economic stimulus. At the same time, it's a cost. And I don't think those two things ever get quite weighed out fairly. But nonetheless, costs are going to go up.
There's some concern about Medicare and Medicaid, which already do not pay you the full cost of what you do for those patients. And there may be attempts to further reduce what they pay. Regardless of what the Cleveland Clinic does, will hospitals nationwide and doctors be more reluctant to treat Medicare and Medicaid patients?
Well, that remains to be seen. I don't know. But I think you have to understand that right now, across the nation, hospitals lose about 5% on treating Medicare patients and about 14% on Medicaid patients. And if we push more people into the Medicare and Medicaid categories and decrease the private insurers, the percentage there, that's going to be a problem for hospitals. And so I think that what I tell people at our hospitals, we have to figure out how to treat people more efficiently with higher quality. And at the end of the day, quality always brings down costs.